Before beginning the physical examination, the examiner first introduces themselves, clarifies their role, confirms the patient's identity, and explains the intended examination using patient-appropriate language. The examiner gains consent, offering to provide a chaperone if this is appropriate, and washes their hands. For a detailed description of how to prepare for a physical examination, refer to the course Preparation for Physical Examination. To perform an examination of the neck, the patient is positioned sitting on a chair away from the wall, directly in front of the examiner, with elements of the exam performed while the examiner stands behind the seated patient. The neck and the upper chest should be fully exposed, and, if wearing a shirt, the patient can be asked to undo their top buttons. Long hair should be either tied up or moved out of the way of the neck. A general assessment of the patient is first made in order to gauge their overall level of health, and physiological parameters should be checked if equipment is available. A focused general examination is then performed. Starting at the hands, the examiner looks for peripheral signs suggesting infection, malignancy, and evidence of hyper and hypothyroidism, including a fine tremor or evidence of thyroid eye disease. For detailed descriptions, refer to the courses General Examination and Vital Signs and Examination of the Thyroid. A systematic assessment of the neck is next performed to cover the anterior, lateral, and posterior aspects of the neck. The neck is inspected to identify any lumps or swellings, scars, evidence of radiotherapy, distended veins, or areas of notable asymmetry. The neck can be divided into anterior and posterior triangles. Deep to the superficial cervical fascia and platysma muscle, the anterior triangle is formed by the anterior border of the sternocleidomastoid, the inferior border of the mandible, and the midline of the neck. The borders of the posterior triangle are the posterior border of the sternocleidomastoid, the middle 1/3 of the clavicle, and the anterior border of the trapezius. The anterior triangle can further subdivide into 4 subtriangles: the submandibular, submental, muscular, and carotid triangles. The inferior belly of the omohyoid muscle passes deep to the sternocleidomastoid and crosses through the posterior triangle, further dividing it into the occipital and subclavian subtriangles. If a lump is identified, its location should be noted and its characteristics defined by formal palpation. Inspection of a neck lump can also be performed as the patient is asked to swallow and to protrude their tongue. A thyroid gland mass will move superiorly with swallowing, although an invasive thyroid malignancy may not move if tethered to surrounding tissue. A thyroglossal cyst will move superiorly when the tongue is protruded, whereas thyroid masses and enlarged lymph nodes generally will not move on tongue protrusion. Palpation of the neck includes palpation of the major lymph node groups in order to assess for lymphadenopathy. The lymph nodes of the neck are historically divided into at least 6 lymph node levels for the purposes of head and neck cancer staging and treatment planning. Note that slightly differing definitions exist between specialties. To palpate the major lymph node groups of the neck, the examiner generally stands behind the patient so as to be able to palpate the groups bilaterally, using the pads of the middle 3 fingers to try to roll the lymph nodes over the surrounding tissue. The submental and submandibular lymph nodes are palpated first, starting under the mentum and moving along the inferior border of the mandible. The tonsillar and parotid lymph nodes are palpated behind the gonial angles and over the inferior rami of the mandible. The preauricular lymph nodes are palpated for anterior or rostral to the ear. The postauricular lymph nodes are palpated posterior or dorsal to the ear. The anterior cervical group is palpated descending along the anterior border of the sternocleidomastoid muscle towards the clavicle. The posterior cervical group is palpated ascending along the posterior border of the sternocleidomastoid towards the mastoid process. The occipital lymph nodes are palpated over the occipital protuberance and the mastoid process. The supraclavicular lymph nodes are palpated from medial to lateral, along the superior border of the clavicle. The patient is asked to tilt their head away from the examined side to better enable palpation behind the posterior border of the clavicle in the supraclavicular fossa. The infraclavicular lymph nodes are palpated along the inferior border of the clavicle, moving from medial to lateral. Finally, the paratracheal lymph nodes are palpated, ascending along the posterior borders of the trachea. Palpation of the salivary glands can also be performed in an examination of the neck. The submandibular and parotid salivary glands are best palpated bimanually, and the examiner dons a single non-sterile glove after first explaining the intended procedure to the patient. The examiner places the index finger of the gloved hand on the lateral floor of the mouth, with the non-gloved hand feeling for the submandibular gland under the inferior border of the mandible. Palpation for the parotid gland can also be performed bimanually, and the examiner uses the gloved finger to try to push the anterior parotid border laterally to capture the gland between both hands. Palpation of the parotid gland can also be performed extraorally. The parotid gland lies across the lateral surface of the mandibular ramus, where it overlies the masseter and folds itself around the posterior border of the mandible. The patient can be asked to clench their teeth, tensing the masseter and feeling for the parotid over the lateral and posterior borders of the mandibular ramus. Sometimes, auscultation over the carotid arteries might be performed to listen for a bruit, suggesting turbulent carotid blood flow. Note that carotid auscultation is now rarely performed in clinical practice. To complete the examination of the neck, a full examination of the thyroid, including peripheral thyroid status, should be performed. For a detailed description of this, refer to the course Examination of the Thyroid. Upon completion of the examination, the patient is thanked and the examiner again washes their hands.